All right, thank you, everybody. My name is Melissa Rosenberg. I am the Executive Director of the Howard County Autism Society, and we're very happy to be presenting this brown bag workshop on Go With Your Gut today in partnership with Pathfinders for Autism. Okay, we are ready to begin. I'm going to share screen, and before that, I would like to introduce today's speaker on this virtual presentation of gut health and autism. We welcome Dr. Pamela Compart. She's a developmental pediatrician and integrative functional medicine physician who has a particular expertise in and passion for treating children with autism. Her approach to working with children includes looking at the whole child to make the best recommendations for both more traditional outside-in therapies and less traditional treatments inside-out that enable a child to reach her full potential. So welcome, Dr. Compart. I'm going to go ahead and share screen. She has some slides to share for us today.
Great. Good. Well, thank you, everybody, for giving up time during your busy days to share some time together. I appreciate the opportunity to talk with you. Before we begin, I just thought I'd give you a little bit of more explanation of my background. My traditional training is as a developmental pediatrician. I'm a board-certified developmental pediatrician. And developmental pediatricians receive the same basic initial training as general pediatricians. We do 3 years of training in general pediatrics, but then we do additional years of training specifically focused on behavior and development in children. And that can range from a wide range of issues, ranging from cerebral palsy, spina bifida, psychiatric issues, autism, learning disorders, anxiety, sensory issues. And within that range, different developmental pediatricians will pick different areas that they have more of an interest in. And my particular area of interest is over the years become children with autism and their families, but I also see a lot of children with anxiety disorders, sensory processing issues, learning disorders, and the like. I've been doing developmental pediatrics for about 30 years, and about 20 years ago, I realized that while that approach worked for a lot of children, there was a whole subset of children that was not sufficient. And so for about the past 22 years, I've combined this biomedical or integrative medicine approach. And we're going to focus on that today. Next slide. So it's important to know that what I'm going to be talking about today is part of a comprehensive treatment plan. And so when I see children, the first thing I do is a traditional developmental pediatrics evaluation to make sure that we have not missed traditional medical issues that need to be worked up, and to focus on making sure that the school therapy placement and that the therapies are all optimized. And to me, those are the outside-in treatments. And then we look at the inside-out treatments. Traditionally, that would involve medications, but from an integrative medicine perspective, that involves biomedical treatments that include things like dietary change and nutritional supplements. So what we'll focus on today is the biomedical side of the inside-out. Next slide. So people will call this integrative medicine or complementary medicine or alternative medicine, but the more helpful approach is to think of this as functional medicine. Next. So functional medicine really is a more comprehensive way of thinking about medical conditions that is looking at the underlying causes that might be contributing to the symptoms that we see. Next. And it sees these factors as a very interconnected web where one factor may affect another. Next. And in the bigger picture, looks at the interrelationship between your body, your mind, and your spirit. Next. So the nice thing about a biomedical approach is it addresses the issue that a diagnosis does not tell you what is causing your symptoms. And many of you may have experienced that one problem with having an autism diagnosis is people often stop thinking about your child because they say, well, autistic children have sleep problems and autistic children have constipation issues. But we still need to think about why they have them, what's causing the symptoms, and then how those symptoms are relating to the behavioral or developmental issues. So the biomedical approach is all about looking underneath the diagnosis for the contributing causes. Next. So if many of you, I suspect, have tried to Google autism and supplements or autism and diet, and your brain probably exploded from the thousands of options that appeared. for you. And I always say those are 1,000 options for some generic child who's not yours. And you also need a way to feel organized about it because it feels very random and disorganized. So functional medicine is one way to help you have an organizing principle when you're thinking about this approach. And so when I see a child, really I start with, we're just going to ask and answer 2 basic questions about the child who's sitting in front of me. And the first is this child's body and brain getting everything they need to function optimally? And then the second question is something getting into this child's body or brain that is interfering with their ability to function optimally? Next. So in the bigger picture, really all we need to do is give what the child's body and brain need and get rid of what's interfering, with the goal of then hopefully optimizing body and brain function. Right? Now that gets very complicated, and so that requires, it's optimal for someone to help guide you. So what are some of the other benefits of functional medicine? One of the big benefits I found is that it does not require a diagnosis. So it can really help a child who does not fit into a nice, neat diagnostic category. I often say that children don't read any of our books. They don't know the diagnostic criteria. And so they may not know how many criteria they need to fit for us to give them a label. So if your child needs 6 criteria to have inattentive type of ADHD and they only have 5, we can't call it ADHD, but that doesn't mean they don't have a lot of problems with their attention that we need to address. So functional medicine is about optimizing the function regardless of what the diagnosis is, and so it has a very broad application. Next. So at a minimum, what we hope from this approach is that we make the brain more available. If it works better, it can respond better to all the external therapies and schooling that you're doing. And at its optimum, at its best, what we hope is that we make the brain and the body work better so that you have less need for external intervention. And this approach assumes that it's not just about a brain issue itself, that there are factors outside the brain that can affect the brain, and that these factors are all potentially treatable. Next. I want to mention a few caveats about this approach. Next. So one thing is most people are getting their information from the internet. And again, as I mentioned, that can seem like it's very random data without an organizing principle. And again, functional medicine can provide a way to think about this in an organized way. Next. And again, and the internet recommendations are about some generic child with autism, not your specific child. And it's really important to individualize, and it's important to remember this approach is not treating autism. We're treating children or people who have autism. And one child's individual situation may not be the same as another one. So we really need to individualize our treatment package for each child. Next. And then there are a few other caveats to think of. Next. It's really important, I think, to have reasonable expectations of this approach. Many of the people who post online are people whose children have had dramatic improvements, which certainly happen. It is certainly possible to change a diet and in 3 days have a different looking child. But the more common response is that some treatments will help and some won't. And so you almost often stair step up your improvements where you get a little improvement, something else didn't help, the next thing helps. And so slow, steady improvement is more the rule than dramatic improvements. Next. The other really important thing to remember is that just because a treatment is natural does not mean it does not have any side effects. So when you're doing this treatment, you need to consider what the risks and benefits are of supplements, for example, the same way you would want to know the risks and benefits of medications. So when I see patients, I do a lot of education and treating about the indications for treatments, what the risks are, what the benefits are. So if you're going to put something in your child's body, you can feel very comfortable, you know what to expect in terms of benefits and what to be watching for in terms of side effects. Next. The other thing I'll talk more about at the end is it's really important to use good quality supplements and in safe doses. And when I see patients, I'm very specific about companies that I like, vendors that I like, sources, so that you can feel comfortable that what's on the label and what's in the bottle are the same, and that we can trust the supplements that are going into your child's body. Next. So there's a quote that I like to live by, which I wish I knew who said it so I could give them credit, but next. And it says to be discerning, next. But it says keep an open mind, but not so open that your brain falls out. All right, so just try to be discerning on the treatments that you use. Next. So in this 2-question approach, let's see what could fall under each side of the questions. And the first question is, what does this child's body or brain need for optimal functioning? And we can go through the whole list here. The first is an adequate diet, which includes sufficient protein and clean, organic, preservative-free food. Next. Next, please. You need adequate nutrients. There are a lot of nutrients that are important in autism. We certainly can't talk about all of them today. They include zinc, iron, vitamin D, magnesium, B vitamins. And we'll just talk about 2 of the most common deficiencies today, which are zinc and magnesium. Next. A healthy gut microbiome, which is the balance of bacteria and other organisms in your gut. Next. And there's research in the past 10 years on a hormone called oxytocin, which may be important for social functioning in autism, which we're not going to have time to talk about today. Next slide. And then on the flip side, what could be interfering with the optimal function of the body or the brain? Next.
All right, folks, can you please mute? Somebody's phone is ringing. Thank you.
Right. So a common interfering factor, which we're not going to talk about today because it's not gut related, is histamine from traditional allergies. Next. Reactions to foods, which we will talk about, most particularly casein and gluten are the things most people have heard about. Can react to certain additives like MSG, and there's a natural chemical called phenols, which a number of kids will react to, which we'll discuss. We're certainly living in a very toxic world. Most of the toxins come from outside our bodies, but we also generate toxins internally. We'll talk a little bit about that. Next. And then if we have time, we can talk about oxidative stress and inflammation. Next. The other helpful organizing principle I found helpful is from a mentor of mine, Dr. Sidney Baker, who has a longtime functional medicine practitioner in autism, who has a sense of humor, and he has what he calls his thumbtacks theory of functional medicine. Next. Next. And he says, if you came to me and your symptom was that your bottom hurt, and we figured out the reason your bottom hurts is that you're sitting on 2 thumbtacks, and I take out one of them, I didn't automatically make you 50% better because you're still sitting on a thumbtack and you're still in pain, right? So the goal is to remove all the thumbtacks. Next. If the first treatment is a big thumbtack and you take it out, you might see immediate dramatic improvement. So these are the people who, when they take out gluten and casein and 3 days later, they have a child who looks very different. It happened to be for that child that was a big thumbtack, and you saw something from one improvement, one intervention. But more commonly, most of us have many thumbtacks. So just to make the math easy, if you assume you have 5 thumbtacks and they're all 20%, and you take out the first thumbtack and don't see anything, it's easy to get depressed and disappointed about that you only change 20% of the problem and you still have 80% left. It makes sense that you might not see anything from one intervention. So oftentimes you need to take out 2 or 3 thumbtacks and you don't see anything until the 3rd thumbtack, and then your brain now has 60% of the problem removed from it, and now you see a difference. So what this analogy, though it's sort of tongue in cheek, it taught me to be patient and to not be disappointed if each individual treatment, if I have a good reason to believe it should be helpful, doesn't in and of itself result in a difference. Next. So here are the things I'm going to try to cover in the time that we have today. The GI system, starts with your mouth and what you take in and goes to the end of what you put out. And all of you know the 2 things you can't make a child do are put something in and make something come out if they don't want to do it. So you want to think about things from the beginning to the end. So we'll talk about feeding difficulties and what can cause that and how we can treat those. Some basics about a healthy diet, some of the common nutrient deficiencies. We'll talk about constipation, which is a very common problem. The gut-brain connection, the gut microbiome, which is the balance of bacteria and yeast, leaky gut, and a little bit about elimination diets. Next. So let's first talk about picky appetite and what are some of the causes. Next. So, a not uncommon problem is to have discomfort, whether it's reflux or heartburn or constipation. Next. Many of you know a very common issue with eating is sensory sensitivities, and kids can reject foods for a whole host of reasons: the taste, the texture, the temperature, the way the food looks, the smell. And they're often like the childhood story, The Princess and the Pea, where the princess could feel the pea underneath 100 mattresses. You've all seen kids who can tell from across the room that you've put a speck of a supplement into an applesauce and they won't take it because it's too distressing. Zinc deficiency we'll talk a fair bit about because that's a common contributing factor that is treatable for picky appetite. Next. And food cravings, particularly for casein or gluten. Next. So let's talk in a little bit more detail about some of these medical issues. Next. So reflux is a not uncommon problem in kids, including kids with autism. So the common things we think about from a traditional medical perspective as clues to reflux would be if your child's burping a lot, if they're making a lot of swallowing noises from food, coming back up in the esophagus into the mouth and then swallowing it again. And some kids you'll even see partly digested food come back into the mouth, they'll chew it and swallow it again. But a clue that often gets missed is the kids who are really having a lot of behavior issues with going to bed, going to sleep at night, in particular, refusing to lie down in their beds. And they often get labeled as behavior problems. But a subset of those kids are refusing to lie down because they have reflux. And when you are upright, gravity helps keep the acid and the food in your stomach. But when you lie down, heartburn gets worse. And so some kids are refusing to lie down because they are in pain when they lie down. And when you treat them with reflux medications, often the so-called behavior problem for sleep will get better. So think about that as a possible clue. Next. Constipation, all very common, particularly in kids who are picky eaters. And that can be either skipping days or having very small pellet-like stools. That can certainly affect appetite. Next. You have to think about dental issues, particularly in children who won't allow good dental hygiene. Are they not eating because they have cavities or abscesses or other sources of pain? Next. And then there are other more specific medical diagnoses that can only be diagnosed by a gastroenterologist, putting a scope down and looking in the esophagus and the stomach and biopsying. And those can then also be treated. Next. So sensory sensitivity is a big issue for most children with autism. Next. Again, you can reject for a variety of different reasons. Next.
Oh, that's so fun.
And it's important for your child to remember that their perception is their reality. So if they think it doesn't feel good in their mouths, that is true for them. Next.
About 5 years ago. Okay.
So sensory sensitivities are very visceral reactions and they're hard to overcome. So if you've ever had eaten a food and on that same day gotten a stomach virus that caused you to vomit, in your mind, you may connect that food with vomiting, even if the food doesn't cause it. And you know in your mind it's not caused by that food, it still may be very hard to eat that food again. Much less if you're a young child with autism who had a bad experience with a food in their mouth, it's going to be very hard for them to get over that without some kind of intervention to eat that food again. Next. So you can address this externally with occupational therapy to work on desensitizing the mouth, and you can use behavioral protocols to try to get kids to try food, but you can also deal with the underlying biomedical factors, particularly zinc deficiency and something called oxidative stress are probably the two biggest contributing factors. Because if you don't treat those things, you're kind of going to be working against stuff that's making the experience unpleasant for the child, and it's harder to overcome that with behavior therapy alone. Next. So zinc deficiency, very common in kids that I see. Next. And the importance of this for feeding is that zinc deficiency affects taste perception both at the taste buds and at the brain level. Next. And if you can't taste the food, there are many foods who have textures that are unpleasant, but we eat them because the taste overrides the texture, right? So if you think about some of the vegetables we eat, like broccoli would not be particularly pleasant if you couldn't taste it. A gristly steak, a slimy ground beef. And so if you can't taste your food and all your experience in your mouth is texture, it's going to be very unpleasant, and then the kids will reject food. Next. So if you can diagnose the zinc deficiency and then treat it over time, the taste will come back, and then the behavioral techniques may work better. If therapists are working about, put the food up to your lips, you don't have to eat it, put it in your mouth, you can spit it out. If you can actually get the food eventually back into the child's mouth once they aren't zinc deficient and they can taste it and have a different experience of the food, they may then be willing, they won't have just a sensory experience and be more willing to eat. Next. So you can get into this very vicious cycle with sensory issues and zinc deficiency. So let's say your child has sensory issues and then they won't eat meat for it's too gristly, it's too slimy, and meat is your main source of zinc. And then you get less good taste. And then you get more sensory sensitivities. You keep going around and around, and you'd have to really just try to interrupt the cycle by addressing both the sensory issues and the zinc deficiency. Next. All right, so let's talk a little bit more about zinc. So what are the common reasons for getting zinc deficient? Next. The first one is if you're not eating enough animal protein, especially red meat, and many people are avoiding red meat for health reasons, but a lot of kids won't eat any meat. Next. If you have a very carbohydrate heavy diet, that can lead to zinc deficiency. And the reason is that when you have high carbohydrates, they digest to glucose. So when you have high glucose, you need insulin to bring your glucose down, and the insulin molecule needs zinc. So the more you're bouncing your blood sugar up and down, the more you're using up zinc, and over time you can become deficient. Also, if you are on acid suppressing medications, that can affect the absorption of all minerals, not just zinc. I'm not saying you shouldn't use the medicines, but just know that this is a side effect. And also people who are vegan or vegetarian. And ideally, it's ideal to get a good blood level for zinc before treating, so you know how much to treat. If I could also ask if anybody's not muted to please mute. There's a fair amount of scratching noises in the background. So another cause of picky eating is food cravings. Next. So a number of children with autism will crave dairy or wheat products. Next. And this is because, next please. This is because they may be making opiate-like compounds from breaking down casein, which is the main protein in dairy, or gluten, one of the main proteins in wheat and other grains. And we'll talk about this in a little more specifics later. Next. But if they're making these opiate-like compounds and they eat the foods, they can really cause them to have drug-seeking types of behaviors. And if they're being driven biochemically in a drug-seeking type of way to eat dairy or wheat, then they may exclude other foods from their diet because they're not giving the brain the same good feeling. So going on a gluten-free, casein-free diet may reduce those cravings. Next. So let's talk a little bit about what you should have in your diet. You need a good balanced diet, especially need for protein, and ideally, to the degree that it's possible, organic foods that are free of or low in toxins or preservatives. Next. So this is an old slide, so I suspect the numbers are worse than when I last made it, but this is what we call the standard American diet, which is appropriately abbreviated SAD or SAD. And in the year this data was taken, the average adult American was eating 30 pounds of fries, 141 pounds of sugar a year, more junk food, more bad fats, and less of all the healthy foods. And just like with the computer, when they tell you garbage in, garbage out, same is true for your body, garbage in, garbage out. Next. So a very wise parent said this. She said, Hippocrates first said, let thy food be thy medicine and thy medicine be thy food. But the parent added this caveat. Next. If you could just go through the whole list. Good advice, but probably a lot easier to follow in 400 BC when you didn't have to contend with 3 McDonald's, 2 Starbucks, and a Cinnabon within a 5-mile radius of the Parthenon. right? So I appreciate that the things I'm telling you are easy to say and harder to do. But the first thing you want to focus on, I think, is having a good balance of protein in the diet. Next, because if you eat primarily carbohydrates without sufficient protein, what we call a high glycemic diet, when you have that imbalance, your blood sugar rapidly rises and then it crashes. Next. When your blood sugar drops, you get inattentive, you get irritable, your brain just can't work. You're probably familiar with the phrase hangry behaviors, which is you're hungry and you're angry. And it doesn't matter what therapy you have in place until you get the blood sugar up, your child can't respond. And this is because carbohydrates are digested faster than protein. Next. If you have enough protein in your diet at the time you're eating the carbohydrate or enough fiber, they are digested slower. So the carbohydrates in the stomach at the same time will be digested slower. Next. Next. And that will keep your blood sugar more even for 3 to 4 hours instead of crashing after 2 hours, which is long enough to get you from breakfast to lunch or lunch to dinner. Next. The most important meal seems to be sort of sets the stage for the rest of your day is breakfast. So it's important to have protein at breakfast. And the key thing is it does not need to be a breakfast food, because we think about, well, my child won't eat eggs or bacon or sausage. There's no reason you can't give leftover chicken or leftover meat from dinner or peanut butter. It does not have to be a quote unquote breakfast food. Next. Now, my co-author wrote a book on a cookbook and a how-to guide on diets for ADHD and autism. And she said it's ideal to eat your protein first, though I'm happy if you just have it at the same meal. But she said, just like you don't eat dessert first at dinner, you should think about cereal as your breakfast dessert and eat it after your protein. Next. So what can glycemic diets cause? And you can just run through this whole list. Poor focus, mood swings, behavior problems, cravings for sugar and starch, not wanting to eat vegetables, and then picky appetites, frequent hunger, and then over time, unhealthy, a lot of different health problems can develop.
Where's it?
And if everybody could please stay muted, I would appreciate it. There's still some noise in the background. So what involves a healthy diet? This is just a chart from our book, but if we go to the next slide, we can focus on the protein component, because the question is, how much protein do you need? So if you look at, let's say you have a 5-year-old child and you need 25 to 35 grams per day of protein. If you divide it by 3, you'll get the range of how much per meal to try to offset the carbohydrates. So you need 8 to 12 grams of protein. So what can give you 8 grams? An ounce of seafood or meat or poultry, 1 large egg, a 1/4 cup of nuts. Nut butters are good, but you need 2 tablespoons to get 8 grams. And for kids who aren't on a casein-free diet, dairy is a good source. Beans are on this list, but they're not great for keeping the protein carbohydrate balance, because they're good for your daily total of protein, but they have a lot of carbohydrates in them, so they won't necessarily keep the blood sugar as stable. Next. The other thing is to try to eat as organic as you can. The challenge with that is it gets expensive. So this group called the Environmental Working Group every year measures pesticide content on foods, and they will post on their website what they call the Dirty Dozen. And then the next slide is the Clean 15. And they look at which foods have the highest pesticide content, and those would be the ones that are placed to put your money for organic. And then the Clean 15 is a place that's less critical to buy organic. Next. So why might you become deficient in certain minerals? It can be that you're not eating enough sources of those minerals. It could be you have higher needs, or you might have poor absorption. Again, my co-author Dana Like, who's a nutritionist, says that we think that nutrition is what we eat. And she said nutrition is not what we eat. It's what we eat, digest, absorb, deliver to the cells, what the cells take up, and what are used by the cells. So there are multiple places where you can have problems that ultimately result in insufficient nutrients. Next. So let's talk about magnesium first. This is the most common nutritional deficiency in the population, not just children with autism. Next. It's needed for hundreds of reactions in your body. Next. It's important for neurotransmitter function in your brain. Next. You need it to generate energy in your cells to do their work. And the food sources are leafy greens, nuts, and seeds, which are not necessarily the highest thing on the list of children's desired foods. Next. So I'm going to run through in a second the list of what you can see with magnesium deficiency, and I would predict that you'll probably recognize some symptoms in your child from this. You can get mood and behavior problems, hyperactivity, anxiety, constipation, startle easily, aggression, defiance, memory and learning problems. Interestingly, excessive yawning and sighing, sound sensitivity, particularly common with magnesium deficiency, sleep issues, tics or tremors, seizures, and salt cravings. So I found in my practice that using magnesium can be particularly helpful for anxiety, for the kids with really dysregulated behaviors, sleep issues, sound sensitivity, tics, and constipation. It's possible, but really unusual to get a behavior reaction to magnesium. The main side effect to watch for is loose stools because magnesium has laxative effect, and there are different forms of magnesium that have more or less laxative effect depending on whether you need that effect or not. And you also have to be careful to have enough calcium in your diet or by supplements to balance magnesium, because magnesium will lower calcium and calcium will lower magnesium. Next. Then just a little bit more about zinc deficiency. Besides picky eating, you need it for hundreds of reactions in your body. Next. It's important for immune function, so especially in this era of COVID and other common infections, good to have a good zinc level. You need it to use your amino acids from protein well. You need it to transport your vitamin A where it needs to go, which is important for eye contact. And again, it affects taste perception. Next. So what are some of the clues to zinc deficiency? Again, we can run through this whole list. You can get a picky appetite, get pica, which is eating non-food substances. It can affect your sensory system, your eye contact. You can get white lines as shown on this picture here. White lines or spots on your fingernails as a clue. It can affect development. You can get skin conditions, low muscle tone. Makes you more prone to inflammation or infections, and it can affect how well you clear toxic metals. Right. So flipping now to what could interfere with brain function, you can be overloaded with toxins, particularly internally generated from constipation. Next. You can have food sensitivities, gut imbalances, and oxidative stress, as well as inflammation. Next. So let's talk about toxins. We live in a very toxic world, which can come from external or internal sources. Next. And we are exposed to 88,000 toxins in the environment. Next. And years ago, the Environmental Working Group did a study of umbilical cord blood and found that there were 280 toxic chemicals in the umbilical cord, which to me is a scary statistic. But the thing we can have some control over is the toxins that you generate from your own metabolism. Next. And a common source of having too many internal toxins is constipation. Next. So this is how functional medicine doctors think differently than traditional doctors about a symptom. So when I was traditionally trained, I was told it's okay if you don't go for every two or 3 days, as long as you're not having a stomach ache. That's just your pattern. But a functional medicine doctor will say, what's the function of the bowel movement? The function of the bowel movement is to eliminate toxins. And if you're not stooling daily, then those toxins are going to be reabsorbed, which can then affect your brain function. And if you aren't stooling daily over time, you can start to be what we call impacted, where you have a bigger buildup of stools and then you just stool softer stuff around it. Next. So when I see an irritable child, I do not have a good explanation for why they're irritable and they're not stooling daily or not evacuating fully, then I have a low threshold for thinking about getting an x-ray to see if they are packed. Because sometimes the physical exam will be normal and then the x-ray will show just full of stool. And then treating constipation and clearing out the tube and clearing out the system can often improve both behavior and appetite. The next thing to talk about is the gut-brain connection. There are lots of published studies now on this, what we call the gut-brain connection. And the healthier your gut is, the healthier your brain seems to be. And the gut talks to the brain and the brain talks to the gut. Next. And this is just showing the same thing. Next. So we talk about the microbiome. Next. And this is the balance of bacteria and other organisms. And you need sufficient numbers of good bacteria. Next. And not too many bad bacteria. Not too many yeast. You need a good diversity of bacteria. Good certain types are more helpful. Next. Next. And you don't want to have too many yeast or other problematic organisms. Next. So the intestine's supposed to have trillions of good bacteria, and it's supposed to have yeast. You can't get rid of yeast, but the problem becomes when you have overgrowth of yeast, which can happen either if you've wiped out the good bacteria from taking antibiotics, or if you don't eat enough fiber to feed the good bacteria and keep them alive and healthy. Next. So one of the problems with yeast is that they can secrete toxins, which if you have a leaky gut and they leak in can affect brain function. Next. Some of the common symptoms we see with yeast overgrowth are inattention, brain fog, silliness or unexplained laughing, and sugar cravings. Next. It can also trigger inflammation in your intestine, which we think triggers inflammation in the brain. Next. We can look for toxins that get in functional urine testing, and we can also do functional stool testing to actually try to grow the yeast. If you're out of balance, the treatment is probiotics, which are good bacteria, and then there are antifungal medications or herbs to directly kill the yeast. Next. Then the next thing to talk about is food sensitivities, which are different from allergies. They're a different immune pathway. The most common offending foods, just by percentages, are casein from dairy, gluten from wheat and other grains, and then probably soy. And to understand food sensitivities, you need to understand this concept of something called leaky gut. Next. So leaky gut is just shorthand for describing what we call altered intestinal permeability. So your small intestine is where you digest and absorb your nutrients, but it's important to remember that it also needs to be a good barrier so that big molecules cannot randomly get into your intestine. So the small intestine lining has tight junctions that are like Velcro, and that keeps the bigger molecules from getting in. So it needs to be like a screen door. Your screen door has holes that are small enough to let air in, but not flies and insects and other things you don't want getting in. The intestine has to do that also. It lets the smaller things in and tries to keep the bigger things out. Next. So in this picture, this is your intestinal lining, and the cells are supposed to be tightly packed together, but if you have space, things can leak through and get into the bloodstream. Next. Next. So what can make the intestine permeable? We can go through the list of these things. Celiac disease can do it. In that, not enough good omega-3 fatty acids or fish oil. If you're not digesting your proteins well. If you don't have enough good bacteria. You don't have enough of good things that the bacteria make called short-chain fatty acids, which help keep the intestine healthy, or if you have too much toxins from yeast. Next. So casein and gluten are proteins, and when they get digested down, they become smaller chains of amino acids called peptides, and then you want to get down to the individual amino acids, which is what you want to let in. Next. If the intestinal lining is intact, these little chains of amino acids or peptides are too big and can't get through. But if your gut is leaky, then those little chains of amino acids can leak into the blood, and if your blood-brain barrier is also leaky, they can get into brain. Next. Next. And so the question is, why does this bother the brain? The theory is that the transmitters in your brain are also little chains of amino acids. And if these little partly digested foods can now look like transmitters or be false transmitters. Next. So this is just showing in a picture what I just talked about. The proteins are long chains of amino acids, and you release enzymes that are like scissors to chop them up. Next. They can be very long. Again, we have the enzymes that are like the scissors. Next. And this can result in these smaller chains called peptides. Next. If the digestive barrier is healthy, then the peptides are too large to be absorbed and won't cross into the bloodstream. But if the barrier is leaky, then the peptides can get in. Next. Yep. And that can stimulate immune reaction and can also cross into the brain. Next. Again, these false transmitters can then either send messages that shouldn't be sent and short circuit your brain functioning, or block transmitters that are in your brain that then can't get their messages through. You can get a whole variety of symptoms: inattention, irritability, hyperactivity, cravings for the foods, etc. In autism, so what I just described is not unique to autism, but what is unique to autism is that is this issue of making these opiate-like peptides from casein or gluten. Next. So if these opiate-like peptides get into the brain, then they can have a drug-like effect. And the common symptoms you'll see from this, these are the children who might be sitting in the corner in their own world, not really responsive. They might be acting very silly. And these are the kids who, when you take gluten and casein out of the diet, may be going through the trash looking for the foods because the cravings are so strong in this drug-seeking like behavior. Unlike testing for allergies, the food sensitivity testing is not as specific or reliable. And the best test for food sensitivities is your child's body. When you take the food out or eliminate it, are they noticeably quality of life better? When you add the food back, are they worse? Oftentimes you can tell the difference. Sometimes you'll see a difference in days, but people say to do at least a month of casein-free before you give up, and gluten a minimum of 3 months, if not longer. And the key point is you can only do elimination diets if you can keep your child nourished. They have to be willing to eat the substitutes. And if they only have 3 foods that they're willing to eat and they're all dairy, you can't take dairy out until they have a better diet and you can keep them nourished. Next. So again, the common diet that people will do is a gluten-free, casein-free diet. And many children, I would say 60, 70%, respond well enough to this elimination diet that it's worth doing. The important thing is not every child with autism needs to eliminate these foods. So there's no every child needs in autism. So I've seen online postings where people are calling casein or gluten poisons for children with autism, and you can't poison your child. It's important that these are foods, they're not poisons, and you only need to be off the foods if for your child they are causing significant problems. Next. Next. The thing, and if your child is a responder, that doesn't necessarily mean that they have to be off these foods for their entire life. Because if the issue is that the gut is leaky, then there are treatments to do to try to heal the gut. And I have many patients who can go partly or fully back on full diets eventually. I want to quickly talk about phenols, which are a natural chemical that is found in foods that are generally good for you and that kids like: dairy products, bananas, apples, grapes, berries, tomatoes, oranges. Next. And these are cleared by a particular enzyme in the liver that needs a nutrient called sulfate. Next. And there are some children with autism who, even if they're getting sulfate in their diet, don't hang on to it well, and then they don't clear the phenols out. So what happens when you can't clear your phenols? Next. The clues to this is sometimes you'll see your child will get red cheeks or red ears that come out of the blue for no reason. They may be more sweaty at night, but the key behavioral thing is these kids are just hyperactive and unreasonably silly for no reason. So the best way to help this, I don't recommend generally taking out all these foods because they're important for enjoyment of life and also have many health benefits. But you can provide sulfate. So we used to, and the best way to provide sulfate is Epsom salts, because the chemical name of Epsom salts is magnesium sulfate. You can put them in the bath, but you can't sit in a bath all day. So there now are Epsom salt lotions that you can massage into big muscle groups. And sometimes if this is your issue, it's the magic cream for hyperactivity. Next. Let's skip these oxidative stress and inflammation slides, please, in the interest of time. Right, so I used to wear this button when I would lecture. You can see that the body is a very complicated little place. And it says, I may look like I'm doing nothing, but on a cellular level, I'm actually quite busy. So even in this fairly quick, short listing of things that can bother brain function, you can see if your child has sensitivities to some combination of these things: food sensitivities and a leaky gut and not enough good bacteria in their gut and too much yeast in their gut and deficient in zinc and deficient in magnesium and potentially other nutrients, and constipated and generating too many toxins, and then two things we didn't talk about, oxidative stress and inflammation. There's no way the brain can be functioning at its best. Next. So what can we do about these things? You can provide a good diet with sufficient protein, keeping your blood sugar balanced. If you're able, eliminating things like, if it's indicated, casein or gluten, eating organic and preservative-free where that's possible. Next. You can correct identified nutritional deficiencies. You can lower interfering factors like treating constipation and lowering that toxic load. Next. You can balance the intestine by giving probiotics and treating yeast, and then treating oxidative stress and inflammation. So you're probably getting a sense that these are the diagnosis and treatment of these things is complex, and when it's feasible and doable, it's best done under the supervision of a functional medicine practitioner, which can be a physician, a naturopath, a nutritionist, for example. Next. So overall, what I've learned over time is that autism is not just a developmental diagnosis. To me, it's a complex biomedical disorder, and potentially treatable. It's a condition that has multiple potential nutrient deficiencies, multiple potential abnormal systems and mechanisms, and there are multiple factors that are originating outside the brain that are affecting the brain, and that many of these factors are treatable. Next. So our goal in this whole approach, combining the traditional with the biomedical, is improved brain functioning and a lessening of the autism symptoms. And people will often say, well, you're giving people false hope with this approach. The way I think about it is not false hope, it's realistic optimism. And I think that then results in reasonable hope for treating children with autism. And I don't think realistic optimism is the same as false hope. Next. So I'm hoping by presenting some of these things to help people shift their thinking from the old paradigm or way of thinking about autism, that autism and developmental disorders are primarily brain-based disorders that are unchangeable and lifelong, to this new paradigm, which that a significant portion of the brain symptoms may be caused by problems that originate outside the brain, and that these factors are potentially treatable. Next. Again, the goal of treatment is better brain function, less symptoms. Next. And functional medicine to me is just another toolbox to use in improving brain function. So when I went from straight developmental peds to being an integrative medicine person, I just doubled my toolboxes. I didn't give up one for the other. And you sort of hope when you combine traditional therapies and biomedical treatments that we hopefully get the effect of 1 + 1 = 3, meaning that these treatments are synergistic. And by combining them together, we can allow children to reach their full potential. Next. And I suspect this is how your brain is feeling at this point.
Thank you so much, Dr. Compart. Amazing amount of wonderful information. And we have some questions here in the chat, and I can read those for you.
I have some that were sent to me in advance. Can I address those first?
Absolutely.
Yes.
Absolutely.
So I appreciate all the questions that came in, and I tried to go through and attach the one that seemed to be the most common questions that got asked by multiple people. So I got asked a number of questions about specific nutritional supplements for specific conditions, which I can't really recommend without people being my patient, but I do want to address some specific things about supplements. I think there are many things to think about. And the first thing is that the quality of the supplement matters. That you really want to be comfortable when you're giving a supplement, that what's on the label and what's in the bottle match up. If it says it's gluten-free, you want to be able to trust that it's gluten-free. If it says that it has 100 milligrams of magnesium, you want to know it has 100 milligrams. And so not all supplements are the same. I think as a first level of quality control, it's probably better to buy, rather than going to a grocery chain or some national vitamin chains. If you go to an organic market, they are probably going to already be screening their supplements for things like preservatives and dyes and things like that. And you might already be getting a little higher quality. For things like fish oil, you want to be careful that you are using a good quality company, because the fish oil, you want to have a high amount of what are called omega-3 fatty acids, and the fish sources of omega-3s those fish are often also high in mercury. So you want a company that is screening for mercury, so you're not giving mercury with your fish oil. I don't want to mention a lot of brands, but two specific brands that I think do a good job of that are one called Nordic Naturals, Nordic Naturals, and the other one is Barleans, Barleans, and you can often find those brands. That's organic markets. I will give a shout out to one company that I've used for a long time online that I think has very high quality supplements called Kirkman Labs, Kirkman, not Kirkland, which is Costco, but Kirkman, Kirkman Labs. What I like about them is they've been doing supplements for kids with autism and other issues for as long as I've been doing integrative medicine, so at least 20 years. They provide supplements that are in low enough dose for children. A lot of the stuff over the counter is too high a dose. It's more geared toward adults. And they also are very careful to make clean products. So there's only certain number of places that will provide source materials to the supplement companies. And Kirkman checks for 900 different contaminants before they'll make a supplement. So they are ultra clean products. And then when I see patients, if I recommend a supplement, I'll be very specific about which brands I like for a particular product. The other thing that people don't think about is who's selling you the product. When you buy it at a store, like an organic market, you can probably trust that they got it directly from the companies. But a lot of times when you go online, places may be using third-party vendors, and I don't think we can always know how those third-party vendors are vetted. So you want to be sure that people may not always have good ethics. And so you don't want someone who buys supplements from a company to resell themselves and then dilutes out the product and relabels them and gives you a half-strength product, or doesn't know how to store the product and maybe stores the probiotics, the good bacteria in a hot garage, and all the bacteria die before they send them. So if you're going to buy online, if you're not buying directly from the supplement company, I would look to see if whoever is selling them if they'll list, they usually will list who the vendor is that sells the product. And I'd be a little leery of places that are using third-party vendors and not ordering the supplements directly from the companies. And again, for my own patients, I will provide them specific vendors for specific products. And the other thing I'll counsel, because I think it's hard to know what you don't know. And a lot of supplement companies will sometimes try to make combination products to distinguish their products from somebody else. And sometimes if you mix and match things that have the same ingredients in them, you can get to toxic levels of things. So for example, you might have your child on a multivitamin that has vitamin A, and then you pick a fish oil that's cod liver oil source that also has vitamin A. And then you buy a probiotic who the company says what makes our probiotic so special is we also put vitamins in our probiotic. And then without knowing it, now you have 3 different sources of vitamin A from 3 different supplements, and you might get yourself to levels that are not healthy. So I just be a little careful about supplements that mix a lot of things in them, as opposed to I'm just a probiotic, I'm just a zinc product, things like that. The other thing, I got a lot of questions about, my child is 17, can they still benefit? Can adults benefit? In my experience, there's really no upper age limit for this functional medicine biomedical approach if you're looking for things outside your brain that can affect your brain functioning. So adults can be affected by low blood sugar. Adults can get inflammation from gluten. Adults can react to foods. There are plenty of adults working with adult functional medicine practitioners and having good benefit. The challenge with adults is we've had a lot longer time to develop other health conditions that make it more complicated. But certainly this approach works. It has the potential to work in any age, child or adult. I also got a number of questions about how do you diagnose some of these deficiencies or issues. There are a number of nutritional deficiencies that can be diagnosed through blood testing at places like LabCorp or Quest. You can certainly look for things like vitamin D deficiency. There's some specialized zinc and magnesium tests called red blood cell zinc or red blood cell magnesium that Quest and LabCorp actually offer, which are very sensitive tests for that. So we can often get some basic things just from traditional labs. But to go more in depth, there are some labs that are called more functional medicine oriented specialty labs, which are less likely to be covered by insurance. Sometimes are, but sometimes not. There's very in-depth urine testing that can be done, very in-depth stool testing that can be done, so that we really can have data. It's nice to have data. In little kids, sometimes you can't get the data. Like if a urine specimen requires, an overnight specimen after you've been dry all night, first morning specimen, sometimes it's just not feasible to get. So you can often treat without data, and that's okay too. It just may not go to as high a dose of something as if you had an actual data point to treat. But your doctor doesn't get data all the time either, right? You're going for a headache, your doctor doesn't say, I need the MRI scan before I can treat you. They try to figure out why you have the symptom and treat the symptom. So there are a number of supplements that we can use that don't require data, that might be addressing language or addressing hyperactivity or addressing attention, that don't necessarily have to have data collection. So again, when I see patients, we walk through all of these various options. Had some questions about testing for food sensitivities. This is not quite as straightforward. Testing for food sensitivities is complicated. It's not as straightforward as testing for a food allergy. And there's some controversy about how helpful food sensitivity testing is. And I will say, you'll get my opinion on this. That does not mean there aren't other opinions that are equally valid. In this functional medicine approach, I always say there's the science of what we find, and then there's the art of how any of us applies it. So you put 10 functional medicine practitioners in the same room with a patient, you'll have 10 different plans based on our risk benefit, comfort, our clinical experience. My feeling about food sensitivity testing is if you do it too early in the treatment process, if you have a leaky gut, a lot of foods are going to leak across just in general and trigger an immune reaction. And you may not be truly sensitive to all of those foods. So if I ever do food sensitivity blood testing, I like to do it after the gut's a little more healed. And then if something is still triggering a reaction, I think it's more reliable. The other interesting thing about food sensitivity testing, different than food allergy testing, is if your food traditional allergy testing is high, it's rarely reliable that you have a significant reaction and shouldn't eat the food. But the height of the reaction of the food sensitivity testing does not seem to correlate, guaranteeing that you're having a clinical symptom from the food. So I had a patient with autism whose food sensitivity test for dairy was 100 times normal. And I thought that's got to be the missing piece. And we took him off dairy and one symptom got better. Now it happened to be a significant symptom for him, but it did not change his language. It did not change his social interactions. So it's not as completely helpful as allergy or reliable as allergy testing, in my opinion. There are other people who find it very valuable, and I think it's just a matter of each practitioner and how they fit it into their treatment protocol, whether they find it helpful and when in the protocol it's helpful. And then the last thing I would say I got a lot of questions about was constipation. I think the first place to start is be assessed by your pediatrician, because I think it initially needs traditional diagnosis and treatment. I see a fair amount of kids who have a fair amount of backup of stool in their intestine, and just treating with magnesium is not going to clear that out. Kids often need to use Miralax to clear out. I know there's a lot of stuff online where people are afraid of Miralax for behavioral reactions. I'm not concerned about Miralax personally, especially in the short term. And the advantage of Miralax as a treatment guided by your pediatrician is that it is tasteless and kids will actually take it. To try to do high dose magnesium is almost impossible because it is not palatable and it's hard to clean out the system just using magnesium in this population of patients. Then once your system is clear, then there are a lot of supplements that can keep you from getting constipated again, like magnesium, like vitamin C. But the place to start is I usually send people back to their pediatricians to get a good assessment, sometimes an x-ray. Because again, constipation can be very important for affecting appetite, and also as a subset of kids, so it's really affecting their behavior, either from gas pains from being backed up or from just the toxins being reabsorbed. And in my experience, kids with autism's brains seem to be more sensitive to that toxic buildup. So those were the main top questions that came through for me. I don't know, Melissa, if we have time for any other questions that came through
We do.
for you.
I'm in here. I'm going to scroll back up here. Right. Are there any providers that take insurance that practice integrative medicine? For some parents, maybe a social economical disadvantage and not able to pay out of pocket for treatments like this. Are there any resources so that it's accessible for all?
Yeah, that is a really good question. And unfortunately, most people I know don't participate with insurance plans because you can guess that this is a very labor intensive, time consuming process. Talking to patients for a long period of time, doing complex tests that need to be interpreted. When patients have questions, they're not simple. What's the dose of Tylenol? It's what's the next step in my treatment? And what does this symptom mean? It's very labor intensive, and insurance companies do not like to pay for time or pay for talking to patients. So it's absolutely unfortunate that that does put it out of the reach of some people. Now, I will say it's worth looking for grants. Most of the more traditional grants will exclude functional medicine from things that they'll cover, but some of the more private organizations that provide grant funding that you can apply for will allow the grant funding to be used toward functional medicine. So I'd suggest looking around for that. It does make it a two-tiered accessibility, which is not right and not fortunate, but people find it hard. You can't stay in practice, not being able to charge for what they need to do for their time, how much time it takes.
Yeah. Is there some interplay between medications and the bio approach?
I'm not sure what the questioner meant by interplay. They both have a role. I am very in favor of medication. For some kids, it needs to be the first place. You know, if your child is depressed and suicidal, they don't need a supplement. They need to be in therapy and they need to see a psychiatrist and get stabilized. You know, if your child's aggressive or getting kicked out of their third school for behavior, sometimes you really need to do something that is quicker and more immediate than this very complex getting your body back in balance. You know, the analogy I often use is, you know, if you were an adult with type 2 diabetes and we knew it was from your poor diet and you didn't exercise and you were obese, and we knew if we treated all these factors, you know, you wouldn't need to take insulin. But right now your blood sugar is dangerously high and you have to start with insulin. And then we can look underneath and fix all the other things and maybe you can come off your insulin. So there's definitely a role for medication, sometimes right up front for certain things. And then to me, medications are just another tool, right? So there's nothing, it's not a last resort. It's not, I'll do that if everything else fails. The interplay I see is that medications are treating often specific neurotransmitters, like Ritalin may raise dopamine. And if your dopamine is low, then Ritalin is going to be the right treatment for that, for your inattention. If your depression is that your serotonin is low, then Prozac's going to raise that transmitter. That's going to be helpful. But neither of those meds is going to treat magnesium deficiency or the fact that you're reacting to a food or that your gut's out of balance. So often we just keep raising the medication, not knowing we're missing all these other things. So I found in terms of the interplay that when you treat the biomedical piece, then sometimes you get away with less medication because the medication is treating the thing that it treats. And we're treating all the other things that can also contribute to inattention and depression. You may not need as much medication. And if you need lower medicine, then that results in less risk for side effects from the medication. So they're both valuable, and where they go into the treatment plan depends on the individual child. When people call to schedule with me, I get enough history to help parents figure out if they need to go the medication route first for whatever is acutely happening with their child, or if the biomedical makes sense to do at that particular time.
Thank you. We have another question, and also lots of compliments on your presentation, how helpful and interesting people found it. So thank you for that.
Thanks.
Somebody is asking, what's your take on Nemechek. Am I pronouncing that correctly?
Oh. Hmm. Well, so Nemechek, I don't know him personally at all. He has a protocol in which he uses essential fatty acids and one other intervention. My concern with, and some people have good response to it, but his protocol to me is too limiting. He just wants you to do these two things he recommends, and nothing else, and stop all the other supplements. And it doesn't make total sense to me that just those two things would be sufficient to treat the myriad of symptoms. He has success. He has people who believe in his approach, but he's adamant about limiting other things that I think are important. So I just have a philosophical difference, not with the two things he's recommending, but excluding the other things that I find helpful to the treatment approach.
Thank you. A question from someone here. Do you have any suggestions for sites or books on the gluten-free, casein-free diet?
Well, I can do a little self promotion in that I wrote I co-authored a book with a brilliant nutritionist, Dana Lake, that's now in its 3rd edition, called the Kid-Friendly ADHD and Autism Cookbook, which the first half of it is how-to guide and lots of information about both healthy diets and all the elimination diets we could think of in autism. And the second half is recipes that are free of gluten, casein, soy, all the common allergens.
Great. I'm going to put that link in here. And if you
that's
guys
one-
can just stay on mute, I'm picking up somebody,
Yeah.
but I can't see what it is. Yeah, here's a
that's-
link to the book on Amazon.
Right. The other option, just in terms of a good book, I think on the biomedical approach that I recommend to a lot of my patients, is a book called The Autism Revolution by neurologist Dr. Martha Herbert, who's a pediatric neurologist at Mass General. So very well schooled in traditional neurology, but a really out of the box thinker. And she wrote a book a number of years now, The Autism Revolution, that's written with a science writer, and it teaches you a lot of science about autism, but in a very readable fashion. And I just heard from a patient that it's available on Audible books also.
Very good. Thank you. And I stuck that link in the chat just to the Amazon. I'm sure you can find it elsewhere, but here's another question. If a child is already malnourished and can't do an elimination diet, are there any supplements that could help them process dairy and gluten better until they can?
That's a really good question. There are digestive enzymes that are purported to break down casein and gluten and opiate-like products, but I would be hesitant to just use those in a child who's malnourished without being sure they don't have reflux or other things going on where you would not want to put a digestive enzyme into somebody who had an ulcer, for example. And I think if a child's malnourished, I would not worry so much about what you need to eliminate. I'd worry more about what could be deficient secondary to being malnourished, and getting help both from a nutritionist and from potentially a feeding therapist like an OT or a speech therapist. And again, really make sure that you've talked with your pediatrician about why your child is malnourished. Oftentimes people will only look at weight and decide that you're okay because your weight is okay, but that misses all the things you could be deficient in. And it also doesn't answer the question of why you're malnourished. So either the pediatrician can do that workup, or sometimes you might ask about a referral to a GI specialist who could really think about why a child is in that condition.
Thank you. I know we get calls at our office, I'm sure the Pathfinders folks do as well, about problems with eating, feeding clinics. If you have some,
Yeah, well, there are a lot of different feeding approaches. Certainly, Children's and Hopkins have feeding clinics, feeding programs, inpatient and outpatient. The challenge, as with everything in autism, is the wait lists are tremendously long. So I often recommend people try to find private therapists, either speech or OTs, who have expertise or interest in feeding. Because now we're having trouble getting private therapy now too. The need is so high, but you can often get that started sooner.
Thank you. Yeah, there are lots of waiting lists these days for many things. Here's another question. Have you had success with, I'm going to botch this, sulforaphane supplementation? Pardon me if I mispronounce.
Yes, sulforaphanes. Yeah, this is the chemical
Sulforaphane,
in
thank you.
broccoli sprout extract.
Ah,
Yeah, so the main thing that's been studied with broccoli sprouts is an interesting phenomenon, which affects a very small number of kids with autism, is kids who, while they have fever, are noticeably less autistic. And this is not just more cuddly because they don't feel well. It's the kids who, while they have 105 fever, making better eye contact, better language, more socially connected, and the fever breaks and you lose them. So there have been some studies, mostly by a neurologist, Dr. Andy Zimmerman, where he looked at using this broccoli sprout extract chemical called sulforaphanes, which seems to mimic some of the effect of fever. I've used it in that population of kids. It is not nearly as dramatic in my experience a benefit as the fever itself. Now, other information is starting to come out about sulforaphanes for other benefits. I have not personally researched that yet. So I don't use them a lot because I traditionally have only been using it for that subset, very small subset of kids who are better with fever.
and I did, for everybody, I put Dr. Compart's website in the chat. So you have that information about her practice and her contact information. Someone's asking, where are you located? I'm on the Eastern Shore. Any suggestions for a functional medicine doctor closer to me? We go to Kennedy Krieger already for neuropsych and travel is far.
Well, I currently am doing telemedicine, and I'm licensed in Maryland or Virginia. So I can do telemedicine currently with people in those two states. I don't know any functional medicine practitioners on the Eastern Shore. There's not that many pediatric functional medicine people. Many people have retired who I used to refer to.
Anybody else have any other questions? Here, how do you treat a child who refuses to do blood work?
Well, I often treat without blood work in that situation. I always say if the parent or the child are going to be in therapy after the blood work, it's not worth the trauma. But there are supplements that are anti-anxiety that often will get some of those on board and then try. I also have a home phlebotomist colleague that I've used a lot, and she has gotten almost every child I have with autism coming to the house to draw, with the caveat of, for some kids, it's not good to have their home safe space invaded by somebody with needles. And if you do have a home phlebotomist come, I would pick a room that they don't need to go in case they associate that room with the needles and won't go in it again. So you don't want it to be the kitchen or their bedroom or someplace they have to go in. And I'd say this, if the child has a real medical need for something, then you might have to talk to your pediatrician or psychiatrist, whoever, about whether the child needs to be sedated for blood work. But I personally don't provide that kind of, I don't provide medication for blood work. The things that I do are not, critical medical issues. They're helpful, but oftentimes I can treat without stuff. The first year of COVID, I hardly got blood tests on anybody because we didn't know if it was safe to go to a lab and get blood. So I treated everything without labs that first year. So again, for an individual child, you'd have to decide how important are the tests, what are the things you can use safely without labs, and what things can you not, that you have to wait until you are safely able from a physical and from an emotional standpoint to get labs.
Thank you. Someone asking if you're accepting new patients. This is from someone who lives in Columbia.
Yes.
We know you are. Okay.
Yes, I am.
Wonderful. That's good news. And I should have asked this early on, but how did you get, you have a definite interest in the autism community. Where'd that come from?
It didn't come from, at the time, really having anybody in my immediate circle who had autism. I think I just, I was doing traditional medicine and I was enjoying it, but I was realizing there's a whole subset of kids that were just not getting better. And the group that was not getting better enough most commonly were the children with autism. And I was traditionally trained. I always say I did 11 years of postgraduate training and nobody mentioned nutrition or biochemistry. And I really thought it was crazy, honestly. And I thought, well, I should go read about this and I should go to some lectures. And it turned out it wasn't crazy. It was biochemistry and nutrition. I thought I should learn about this and see if it's relevant to my patients. And it turned out to be very relevant. And then I started applying the approach and saw that I wasn't taking away from my traditional training. I still believe in all of that, but I could add more tools than I had. And it's been the most hopeful and enjoyable way that I practice medicine, is to combine the two. But I didn't plan on doing it. It just it sort of evolved, like most things in our
Sometimes the
lives.
best things in
Yeah.
life kind of happen to us. That's absolutely true. Someone else is asking for your contact information. I will again put that in the chat. The recording will be available, and give us a few days just to clean that up. We also have a PowerPoint to share, and we'll be posting that on the autism site and Pathfinders. We're going to take one more question. What do you think of blue ice fermented cod liver oil?
Oh, it stumped me. I don't know anything about blue ice fermented cod liver oil. I was good till the end. Can't answer
Green
that.
pastures she's added. Green pastures? No? Okay.
Know
I
about it.
know about it. Okay. All right. And Miriam, I asked a question, but I wasn't sure if Miriam, if you want to pop in the chat. Your child who is high functioning doesn't have these issues. I'm not sure then what you're asking the question. So if you want to put that in the chat quickly before we wrap. Oh, if my child doesn't have gut problems, what are other things we can look at?
Oh,
That your
that's a,
practice would look at. I got
oh,
you.
that's a whole
Brilliant.
nother. I mean, there's plenty of things besides good. There's
Okay.
oxidative stress, there's inflammation, there's a whole
Lots of things
nother.
that you didn't. Yeah.
Yes,
Next time we have you come, we'll have you address. That's wonderful. Yes. So we'll-
on my website, I have a little sort of summary on the article section, just sort of a functional medicine approach will list some of the other things.
Mhm. Great. Okay. Lots of thank yous again. And I'm going to post Dr. Compart's website. Has contact information for her. I'm going to thank you so much. This was very interesting, so much great information to share, and everybody is very appreciative. So thank you, Dr. Compart, for being with us today. And everybody, look for future, we have additional monthly webinars and lots of things coming up for Autism Acceptance Month. So please check our website at howard-autism.org, and also Pathfinders for Autism has great programs and information to share. So thank you very much. We'll see you next time.